So the Watchman procedure, or the Watchman device, is a minimally invasive procedure that we electrophysiologists sometimes do in order to protect people with AFib from having a stroke if they cannot tolerate being on a blood-thinning medicine. The Watchman device is a little plug or a kind of a parachute-shaped device that goes into a certain area in the left atrium called the left atrial appendage that blocks that area off, and that is where most of the blood clots that cause problems in AFib tend to form. And so if you close that area off, then that theoretically reduces the risk of stroke to the same extent as taking blood thinners for the rest of one's life. But then we can actually stop the blood thinners after a successful Watchman procedure. So the Watchman procedure is indicated for patients that are at elevated risk for stroke with AFib, and they cannot tolerate being on a long-term blood thinner for one reason or another. The most common reasons are either people have had bleeding events, such as bleeding ulcers in their stomach, blood in the urine, or the most serious kind is a bleeding stroke in the brain. And then the other main group that I see are patients that have problems with gait instability or balance, and they tend to fall. So for those folks, we don't want them to be on long-term blood thinners because we don't want them to fall and have very serious injuries because they're on a blood thinner. So those are the two main groups. There are smaller groups of patients that qualify for the Watchman procedure, sometimes because of an occupation or even a hobby, such as riding horses, for example, or something like that. But the most common reason that we recommend the procedure is for people that have either had bleeding problems or people that are falling. We do ask people to spend the night in the hospital after a Watchman procedure for observation, and I would say 98% of the time, folks go home the following morning. In terms of returning to regular activities, because it's a minimally invasive procedure, there's no incision or anything like that. For the most part, you can return to regular activities 2 days after the procedure. For some activities such as heavier exercise or lifting or golfing, we usually ask people to wait about a week or so.